Welcome to 24-2, which is the oral cavity. I don't have too much to say on here. Pretty much everything that the book says is about all that we'll really cover when it comes to the oral cavity, so I apologize to those who are interested in learning more. As far as the oral cavity goes, functions include sensory analysis of food before swallowing, so not only with taste receptors in the taste buds, but also just mechanically sensing the amount and the texture of the food before it reaches the back of the oropharynx. Mechanical digestion, so breaking down the actual foodstuffs into tinier parts with the help of the teeth. Lubrication by mixing food with saliva and mucus, so the more lubrication you can get, the more chances you have each of those lubricated parts actually brushing up against a taste bud and being able to actually feel it. And then some chemical digestion of carbs and lipids, but this will make a little bit more sense whenever we actually get to what's happening step by step as we go through digestion. And then the verb for chewing is actually called mastication. Some nice pictures on the left. We have a sagittal view, anterior to the left, posterior to the right, of the different sections of the oral cavity. So the oral cavity is bounded superiorly by the hard palate, posteriorly by the soft palate and the oropharynx. You might also see the palatine tonsils back there if you still have them. And then inferiorly bordered by the tongue, and the tongue is actually a giant muscle itself. Made up of a couple different muscles put together. On the right side, you might see, or on the right side, you have a nice picture of anterior aspect, looking at the mucous membranes covering the portions of the oral cavity. It's nice because you can actually see the frenulums on both the top and the bottom parts of the maxilla and the mandible. These actually help hold and attach the the muscles of facial expression onto the superior part and the inferior part. Then you have the arches in the back. They're called the palatoglossal arch and the palatopharyngeal arches. When they're called arches, that means that they're covered by the mucous membranes, but these are actually formed by different musculatures coming together. And in between the two, you might see some tonsils. You might see some inflamed tonsils. And then, of course, we have the uvula, and the uvula is going to help us actually push food back towards the esophagus. Then if we were to look at the individual teeth, we don't pay too much attention to teeth in this course, but the pieces that we do care that you understand are boxed in red. So on the left-hand side, you'll see the crown, or the tooth divided by crown, neck, and root. The crown is where you'll actually see the enamel. Deep to the enamel is the dentin. If you break through the enamel and you actually start having the dentin, this is where you'll actually start feeling it, so this is when it'll become painful. And you can appreciate that because the dentin is right up next to the vasculature and the nerve supply, which is sent through the root canal and enters the tooth via the apical foramen. On the right-hand side, you'll see the differences between the types of teeth within the upper and the lower jaws. They're pretty symmetrical, so what you see on the upper jaw is similar to the lower jaw, and the differences are the number of roots per tooth. So the bigger the surface area of the tooth, the more roots that it might have. In the next picture on the left, or in figure A, you see the palate of a child, which has less teeth than the palate of an adult, which is on the right-hand side. And in the bottom left picture, it's an interesting picture of a skull where you can actually see the teeth that haven't descended yet or rooted themselves in the adult structure, which it's kind of a creepy picture, but I think it's a really interesting image showing the teeth before they've even erupted through the mandible or the maxilla. And then on the right-hand side, we see the adult palate, where we have incisors, both central and lateral. Then we have a pair of canines. Then we have first, second premolars. Then we have first, second, and third molars. Collectively, we usually have 32 adult teeth. The third molars can come in multiple pairs, though. Third molars are what are considered the wisdom teeth. And if you have multiple wisdom teeth that maybe there's not enough room for, that's when they become impacted and you might have to have them removed. Then we have a set of salivary glands. We have three pairs or three bilateral pairs. These salivary glands are secreting mucus into the oral cavity. The names of each of them, parotid, sublingual, and submandibular. Submandibular creates the most amount of mucus for the mouth, and then parotid coming in second and sublingual coming in third. Whenever you name these, you should be able to make sure that you call them the submandibular salivary gland or the parotid salivary gland or the sublingual salivary gland. Each of them make a mix of mucus or buffers. And mucus is essentially water and some, mainly water, with some buffers, so more basic elements. And then the parotid glands, so where are they? So the sublingual glands, sublingual, so beneath the tongue. The submandibular glands, submandible, so below the, or inferior to the mandible. And then the parotid glands are actually just anterior to the ears, and they are what facial nerve, cranial nerve 7 actually pierces through. So whenever you eat something, maybe something really, really sour, and you get that initial sense of like pain in the back while your parotid glands are like squishing out saliva in order to accommodate all of that really sourness. You might actually feel a little bit of pain in the posterior aspect of your cheek, and that's actually exactly where your parotid glands sit. And it's painful because when the parotid gland is shoveling out all of that mucus into the parotid duct, it actually contracts all of the nerve endings that are passing through the the part of the nerve fibers that are passing through the parotid glands, and it becomes actually painful. Here's a nice picture of those three. Anterior to the left, posterior to the right. You see the parotid gland just anterior to the ear. And this picture does a nice job of showing you the parotid duct that is going to dump directly into the posterior aspect of the mouth. Then you have sublingual. This is just deep to the tongue. So if we were to remove some of the mucous membranes of the tongue, then you'd be able to see those. And then the submandibular ducts, these are actually pretty obvious in the cats, which are nice to see. These are going to be a little bit bigger than a lot bigger than sublingual ducts. In the right, we have a microscopic cross-section of what we would see. You can see that the duct is going to be that white space surrounded by some cuboidal epithelial cells, and we'll have mucus cells surrounding that, and then serous cells supporting the mucus cells. Functions of the salivary gland, a majority is water, then we've got some salt, chloride, bicarb, buffers, glycoproteins, antibodies, enzymes, wastes. Just a nice mix that can really accommodate for anything that's coming in from the external environment. Lubrication for the food will actually increase the amount of taste you might have from all of the particles. And for digestion, this is also helping us being able to move it back towards the esophagus and having it have an easy way down the esophagus into the stomach. What do the buffers do for pH in your mouth? Well, the buffers are going to increase the pH. So assuming that you're eating something a little bit more acidic, which we tend to typically do, then hopefully it will balance it out and make it a more neutral pH. And then antibodies and enzymes. Enzymes are going to help break down some of the materials. Maybe it'll help break down some of the bacteria. And then the antibodies are going to help attack any of those pathogens that we don't like. How do we control the amount of secretions that are happening through the autonomic nervous system? We have both parasympathetics and sympathetics. The sympathetics aren't really well studied. We don't really understand what they do. But as far as the parasympathetics go, it's triggered by as soon as the food actually enters your mouth, or if you're even thinking about food, or if you have any irritants in the mouth, or any nausea. If you don't believe this, just start chewing some gum and see if you produce some mucus. Receptors include cranial nerves 5, 7, 9, and 10. These are going to respond to the presence of food and induce secretions. But overall, the end goal is just making a bunch of saliva. Actual chewing. So food is forced into the vestibule. Vestibule is an opening, and it heads towards the back of the oral cavity or the oropharynx. Muscles of mastication help with the chewing and moving the mandible towards or away from the maxilla. You have cranial nerve 5, which is trigeminal nerve. Remember, trigem comes in 3 different branches. We're talking about V3, or the mandible, or the mandibular division. We're talking about masseter, temporalis, lateral, and medial pterygoids. We don't expect you to know the attachment points or what the actions are of each of these 4 muscles, but this is more of a recall from 201. You also need help from the muscles of the cheeks, lips, and tongue. So muscles from the cheeks, this is going to actually help keep the food in the oral cavity. Lips are also going to help keep the food in the oral cavity, and then the tongue is going to help mesh it and move it around so that we get the most amount of mastication as possible, or breakdown of each of the food particles. Once we finally chew it up, then we're going to call that a bolus, and that bolus is going to travel down the esophagus. Now the following pictures I have are just some recall. We don't expect you to know this, but this is nice to refresh your memory from 201. So here we have the muscles of mastication, temporalis, masseter, and then on the right we have the medial and lateral pterygoids. Here's another view from Netter, anterior to the left, posterior to the right. And this is a nice view because they broke away the mandible bone, so you can see the sublingual and submandibular glands. And then coming out of the parotid gland, you can see the parotid duct dumping into the mouth, but you can also see the branches of facial nerve coming out of there too, and coming superficially to the masseter muscle. Here we have an anterior view with the mucous membranes intact, so that you can appreciate those arches and then those tonsils piercing through. And then the last but not least, we have a nice picture. Second to last but not least, we have pictures of where those ducts actually dump into in each of the respective portions of the mouth, along with some of the vasculature that is and the nerve endings that are supplying the sublingual glands. And here's another similar view where we're actually looking at parts of the hard and soft palates. But here we have actually removed some of the mucous membranes so that you can actually see the musculature of those individual arches.